From Agence France-Presse, the true global death toll of COVID-19 remains difficult to nail down 3 years after the first case was detected, though experts agree there have been far more fatalities than officially reported. Patient beds in Beijing Stadium, China could see over 1 million COVID deaths in 2023. The difference between the official and real figures could diverge even further next year, with modeling predicting more than 1 million deaths in post-zero COVID China, which recently narrowed how it counts fatalities. According to the World Health Organization, there have been more than 6.65 million officially reported COVID deaths since the virus was first identified in China in December 2019. However, countries count COVID deaths differently and methods have changed throughout the pandemic. Anto, director of the Institute of Global Health at the University of Geneva, said that attributing deaths to COVID can be a very difficult exercise. Plaholt told AFP that the death of a patient in a hospital in a developed country who had already been diagnosed with COVID could be straightforward, but that is often not the case, and doctors usually do not have much information to guide them. Instead, researchers have sought to compare the total number of deaths from all causes recorded since 2020 to what would have been expected if there had no been pandemic. Using these figures, researchers from the WHO reported in the journal Nature earlier this month that there were 14.83 million excess deaths from COVID in 2020 and 2021, updating a figure first released in May. That is nearly 3 times higher than 5.4 million officially reported COVID deaths over those 2 years. Research from the US-based Institute for Health Metrics and Evaluation estimated in March that the number was an even higher 18.2 million. But Plaholt said that even these figures could perhaps still be underestimated. The toll has risen more slowly this year. A regularly updated tally from The Economist estimates that there have been 21 million excess deaths since the pandemic start, 3.1 times higher than the official number. According to the WHO figures, India had by far the most excess deaths linked to the COVID in 2020 and 2021, with 4.74 million, a figure the Indian government has sharply disputed. Russia came next with a little over 1 million. However, the biggest disparities between the expected number of deaths and the actual figure were in South America. Peru, for example, recorded around twice as many total deaths in 2020 to 2021 as it had in normal times. However, Hanno Almer of Austria's Medical University of Innsbruck pointed out that there were also strong dengue fever outbreaks during the pandemic years in Peru, which could have increased the number of excess deaths without being linked to COVID. Another problem is that many nations have little or no data in the first place. The WHO researchers wrote in last month's study that for almost half the countries of the world, tracking excess mortality is not possible using the data that are available, and for this, we must rely on the statistical models. In Africa, monthly data on deaths was only available for 6 out of 47 countries. Looking forward to 2023, China's lifting of its zero COVID measures loom large as a possible source of new deaths. With the first easing of strict measures in place at the start of the pandemic, few of China's 1.4 billion population have immunity from previous COVID infection, and vaccination rates have lagged, particularly among the at-risk elderly. Modeling by the IHME predicts more than 300,000 COVID deaths in China by April 1 and a total of over 1 million across 2023. Last week, China reclassified what is considered to be COVID deaths, which will now only count if they come directly from respiratory failure, in a move that analysts say will dramatically the number of official recognized deaths. Hospitals across China have been overwhelmed by an explosion of infection in recent weeks, but just one new death was added on Thursday to a tally by a national disease control body. Ali Mokdad, a professor of health metric sciences in IHME, told AFP that good data was the only way we can manage to stay ahead of the virus. I am Lovely Montoya of Manila STV.